how do you manage that load to not drain you and to continue to still stay mentally sound, physically sound? She said, you cannot care about their health more than they do. And what she meant by that was you can dive into their history with them, you can help them, but if you start caring more than they do, you're going to be way ahead of them in care themselves. You're going to get burnt out because they don't follow you along, and you're going to take that energy on in a negative way and soak it up, and it's going to drain you.
That speaks to what power words have.
Totally.
As any physician, as any support person or not, whether you're a doctor, physician or not, what you say, especially if someone truly cares about your opinion.
Oh, totally.
If someone trusts you, what you say, your actions behind what you say matter so much on a subconscious level that can change anything from hormones to chemical processes.
It's dramatic how much it makes a difference.
100%.
Welcome to the Functional Code, your go-to source for decoding optimal health. Join Dr. Addy and Dr. Jace as they break down the science behind pain, performance, longevity, and more, making complex concepts easy for you to understand and apply in your life. Your journey to a healthier you begins with understanding the Functional Code.
Welcome back, everybody, to the Functional Code. We're excited to have you today. We are going to be talking about maximizing longevity as a doctor. Now, there are plenty of providers out there who are working tons of hours, whether that's more physical or not, whether it's body doctors like chiropractors, PT, OT, you name it, next to surgeons and MDs and DOs who are working countless hours in the OR and the ER and the ICU, you name it, man. And so today, we are coming at you today to just really bring about the best way to sustain our bodies and our minds as we continue forward and doing what we love as long as we can. So as always, I am Dr. Addy.
And I'm Dr. Jace. Yeah, when putting this together, we want to make sure we target as many people as possible. I know dentists are all obviously included as well. Any type of physician that you can think of. We're going to touch on anything from the mental health, the stresses in practice, even for those individuals that are coming out of school and want to get a head start on maintaining their structure, their mind long term.
Which I believe they should.
Oh, like especially since we've been in practice, there's a lot of stuff that, I mean, we've learned, we've experiencing, we're starting to notice some of the effects ourselves too.
Yep.
It's how well can we help as many people as possible for as long as possible.
Yes.
Like you said, Doc. So we're going to dive into, like we said, the mental health, managing stress in terms of managing a practice and also patients as well. And then we're going to dive into the physical side of things, some of the daily, weekly stuff that you can do to maintain your body.
Yep.
Also dive into the reasons, your purpose, your why, the mental intention to help others. And then we'll also dive into some continuing education, workplace environment, and maybe a little financial stuff at the end there too. Yeah, when putting this together, there's a lot of experience that we'll touch on from the chiropractic standpoint, but this will have a huge implication to any doctor provider out there.
Absolutely.
From there. So, Doc, mental health, managing stress, this would be a perfect place to start for any physician, especially when you're taking on a patient load for multiple individuals. It wears on us.
Yeah.
I know we see it on a day-to-day basis, but in terms of understanding the stressors from the emotional side, what tips have you utilized throughout the years in your progression to manage the emotional side of patient care?
Yeah, and I love the word that you brought in was emotional load. And starting out in practice, I didn't understand what that meant.
Yeah.
And I was grateful enough to work with, in my first practice, I worked with a lot of RN. They were a big part of how we ran the clinic. And one RN, she was 76 years old. And I remember this story to this day. She grabbed me in the hallway as I was going in between patients, and she said, "You look tired." And I'm like, I think it'd been half a year since I started practice. And she goes, "We need to talk after." And I'm like, okay. So I got done with my patients. We sat down, and she goes, "You're an empath. I know that." And for those of you who don't understand what that is someone who's just very good at reading other people's energy. And I am. And I don't, we've talked in the past on why we think people are that versus others. But yes, and I think a lot of caregivers probably are empaths.
Naturally.
I would agree that that's going to be a huge trait or talent of a caregiver. But she goes, The problem with empaths is they're sponges. And instead of reading the energy and understanding it, you read the energy and then you take it on. And she goes, I know you're doing that. And she goes, you need to quit that. She goes, and she said these words to this day, and I'll never forget them. She said, you cannot care about their health more than they do. And what she meant by that was, you can dive into their history with them, you can help them, but if you start caring more than they do, you're going to be way ahead of them in care themselves. You're going to get burnt out because they don't follow you along, and you're going to take that energy on in a negative way and soak it up, and it's going to drain you. And so she said, I know you want to help every single person that you talk to, but you also have to help yourself, and you need to know how to cut that energy off if they just aren't ready for care, or if they don't want the help even though they think they do. Some patients, unfortunately, are just stuck in certain loops, whether that's pain, mental, what have you. And sometimes they were just looking for information. Maybe they weren't looking for care. And so when you chase them down that road and they weren't ready, you're going to get hurt because that exchange wasn't how you maybe thought it was supposed to go. So I think as far as the emotional load, what it is, how can you see tens to even hundreds of patients and not let because these patients are coming to you for help. They have all this pain, all these issues, and they're expecting you to help them. And it's how do you manage that load to not drain you and to continue to still stay mentally sound, physically sound. That's my best explanation at how I approached emotional load and how it helped me. And really what I did was I started to train myself in how I reacted and how I felt. And instead of feeling the, oh, I wish I could have just helped them feeling, or oh, I know I could have helped them, it was, they're not ready yet. And I can't wait for them to come back and ask for my help. I can't wait for them to get to where they need to be to accept our care. And I just switched the narrative so that I didn't continue to think the way that I thought, and it just changed that for me. So perspective and just, I guess, more of a motivational interviewing of myself. But yeah, I think that was really helpful for me. Doc, how about yourself?
That was really well stated, because I feel the same way, and I've run into this a lot, especially when there's not many other providers that have the systems that we have in the clinic, and are able to help to the extent of what the patient wants as their goal. And then trying to relay that information to them is also slightly challenging. That's where we rely on our case managers, some staff as well, just due to time that we have. And I know I've ran into this so many times, and I even still run into this of we're going to be able to help them so much if they completely buy in. So it's providing them with as much knowledge and the broad overview process on how we're going to be able to go about this to help for their comfort level, but to also help them for their mental visualization of how we're going to be able to go about this as a team is going to be important. But man, even just this last week, there's a couple individuals of actually really unique cases. There was one of a gentleman came in with ribs. He's been going on for 8 years. It's a cartilage damage to a certain extent on floating ribs, and there's not many other ways that you can bleed like muscle contraction energy to that area and get blood flow for not only the pain, and there's a few other things as well that added into it, but explaining it and having them understand is one thing, but he wasn't ready yet. There's other things that he wasn't completely bought in, that in the back of my mind, I'm partially frustrated that me knowing what's out there, a brief overview of what's out there, that there's not many people that can actually treat and heal certain things like that to the level of specificity.
Of course.
It's draining on me. And even at the end of the day, there's certain patients that we sign up, we get better, but there's some that reach a threshold, and those are the ones that I just constantly think about in the back of my mind. So for me, handling those of getting out, going for a walk, thinking about it, knowing that I did the best I could with the time I had, and then move on. So I recognized, and then I don't want to say dumped the information, but put it to the side and just move forward. Because there's other situations, as we're seeing more and more patients of different problems that can come up. It's whatever you can do to handle and track their progress as they get better from there. But really good point of what you said of
Did you feel anything early on in practice regarding
yeah.
the emotional load? Was there a time
Yes.
where you maybe recognized a switch, or how did that work for you?
Yeah, that's a good question. Taking on more patients. So when I first started off in practice in Minnesota, there was other docs that worked to train to run their own clinic.
Yeah.
From there, then they bought their own clinic. And so the patients that they had, I then took on.
Sure.
So there was an exchange to get to know each other.
lot.
That was interesting.
That's a lot.
Yeah.
You're meeting like every patient is new to you, even though they're not a new patient to the clinic.
100%. So it's seeing where they're at, where are their main things, how do we adjust them, what is their preference, how can we help them get better. So then there's a memory component of knowing where they're at, what you can do on a daily basis to either keep on that same path, are they comfortable with it, or do they want to grow and expand, and what are things that you can do to bring them closer to that goal.
Yeah.
That's where you start nitpicking, and that's where the specificity of treatment of anything you do matters immensely.
For sure.
And I know you've probably started running into that role from taking on the Phoenix location.
It is. Everything you just said,
Yeah.
I'm like, yep,
Yeah.
that's me. Like, seriously. And as exciting as it's been to meet everyone and to jump into this role of running Phoenix's clinic now, it's been that for me. It's been, I'm excited to meet every patient. I'm excited to learn about their issues and how I can help them. I'm excited to educate them the way that I want to and maybe they're not used to. And I think they're also excited for a new, fresh perspective as well. So I get to, some of them are searching for that, which is fun too, because I enjoy teaching and learning. But also 2 weeks of that, I remember, because I've been there almost a month now, I would say, yeah, 2 weeks in, I felt that wall and I'm like, okay, yep, I've met my threshold of newness and just, it only ramped me up for so long, and now I'm like, whoa, okay. I don't think I can continue doing that. And it's not to say that I didn't. It's just I needed to do more self-care, and I needed to do more motivation, preparation, and just help on my back end of things. Just, I've been sitting in the hot tub almost every night doing yoga.
Nice.
That has been helpful. I started doing cold plunges again. I've been golfing more. Just doing what you can to really help regulate that added stress. It's not necessarily a bad stress, but just that added stress. And so that can also be a great way to manage that too.
That's perfect. And in terms of like tools, and I've used this when I first started a practice, and it's to a certain extent when I was taking over the Tempe location and then starting a new practice in the East Mesa area is a little different. But I used my front desk staff of having them start the process. And when I first started, there was a piece of paper of when I took over all these patients, because I think on the systematic side of things, but also my time is also limited in terms of seeing as many people, but then making sure that we're able to have quality conversations and knowing what their intentions are. So there was a piece of paper that the front desk gave out saying, you're going to be seeing this provider today, so-and-so is out, or you know that there's a transition, but we want to help you towards your goals and towards better health. What are certain things that you want to be able to do better, and just write those down. So then there's like a stack of papers that we have to where anytime before I adjust them, I look at what their goals are. I have a general understanding of where they want to go, and then having that conversation with them briefly of, okay, this is what we've been doing to get you to what your goal is. So we're going to have to either switch certain things up, or we'll keep on the same path and maybe add in other things or take out other things. So that's where, when you look at a systematic format, use your team, see if you can be as efficient as you possibly can with the systems that you have.
For sure.
Is important.
And take that weight off of you.
Yes.
For sure. I like that actually, because that prep work, it maybe if the interactive exchange of communication between the patient can then just get put on paper, you can take your time to assess that in your own space or your own time versus just having to do that every time one by one as these patients come in too. So I like that. I like that a lot.
And it works well. And you probably don't want to do that for months at a time, obviously. You've met that stress load. Once you have a general understanding for maybe a couple interactions with the patient, you have a general understanding. But yeah, it's just some of those practical tools that help you moving forward from there. Now, let's say and then this comes up quite often with the emotional load of change of weather. We notice, I know myself, a huge change and increase in symptoms for most people, and handling the biggest stressor at each person at a time that they have, and then giving them one tool, maybe each visit, or building off of one tool that then can help them for their re-aggravation, if we will also help significantly. So more or less what I mean by that, anytime there's a different change in weather, oftentimes there's different changes from the hormone, the chemical changes throughout the body that can elicit more pain receptors. So whether that's you have them do more mobility work, have them go for a walk, do some pool work, take less pressure against gravity off their body, there's different things that you can use there. But I guess, Doc, when you first hear of flare-ups with a bunch of patients and how to deal with them, what does your mind go to?
Love that. This is a great question, because
that.
I can already think of the 3 patients I talked to yesterday or today on
Yeah.
how I approach that. And for me, it's exciting to actually get to talk about how to coach patients through this, because I think it's unfortunate. There's a lot more improper communication around this subject than how I would go about it. And I know this because I hear what other doctors are telling my patients when they end up having these issues. And so I have to almost re-coach or out-coach them, because unfortunately they're just not getting told what I think is most appropriate. And to the point, let's say a patient comes in who has been doing really well, and then they have a flare-up, and now they're defeated, and they're thinking maybe this isn't going to work and I'm going to have to live with this for the rest of my life. I actually meet them head on and I say, quit thinking like that. Stop telling yourself you're not going to succeed. You need to quit this. I had a patient the other day. They were told that they had awful neck and they had an awful back and their discs were bad, and they were told all these things, and they were 39 years old. And I'm like, oh my gosh, something wasn't right, because I hadn't seen this patient before. And so I was like, let me reassess everything. I gotta know more information. This doesn't make any sense.
Yes.
What the heck's going on? You're too young to have this kind of issue. And so we went through everything. Luckily they had MRIs for me to look at. We reviewed the x-rays, and I got through it all, and their imaging was clean, like very clean, meaning there weren't things on the images that I would have ever brought up
As pain generators.
as pain generators. On the MRI, yes, there was bulges.
Okay, sure, could be.
Slight. We know in a younger population, 70% of those under 30 have bulges that are asymptomatic. And so I take that strong course of saying, I highly doubt that's your issue. Not to say that those kinds of things can't cause issues, but I'm going down a rabbit hole there, but it was my very confident opinion that she had been putting herself in this negative feedback loop because of what she was being told. And she was just telling herself that she's a weak, fragile, in pain, all these things. I got these bad discs, I can't do anything. Anytime I go to the gym, I'm sore. It's because she just didn't have a good understanding of what our bodies go through when trying to rehab away from pain or to improve upon. So I finally told her, I said, stop telling yourself you have issues, number one. I don't want to hear you say that you have issues ever again. Number two, I want you to go work out and I want you to go move your body. And when you're sore, I don't want you to say, I did something wrong. You didn't do anything wrong. Your body's just sore because you haven't been doing this, because you've been sitting and resting because you think you're in all this issue, have all these issues. And so I take that negative experience for them,
Yes.
and I turn it into something positive, and I coach them through that. And those times where I know if we can lean into that negativity with them, if you do that 10, 15, 20 times a day, you're going to get drained. But that's not how we should even be talking about patients anyway. So I use those experiences to completely motivate them. And I turn them around and I say, stop acting like that. You are going to succeed. Don't give up. Quit telling yourself you're weak. Stay positive. And usually, most of the time, they get through that. They start feeling better and they stop ruminating, and we can get forward. And it jazzes me up to be able to be the person to give them probably information they've never heard from a provider. And it's sad. It really is. But I've done that multiple times even in the past 24 hours because I'm dealing with those kinds of conversations and that kind of patients. Definitely that's how I go through flare-ups.
That's amazing. And that speaks to what power words have.
Totally.
As any physician, as any support person or not, whether you're a doctor, physician or not, what you say, especially if someone truly cares about your opinion.
Oh, totally.
If someone trusts you, what you say, your actions behind what you say matter so much on a subconscious level that can change anything from hormones to chemical processes.
It's dramatic how much it makes a difference.
100%. And I think that's where most physicians, and I wish this was taught more in like graduate school and
Yeah, we didn't have a
school.
communication class. History taking, like how to ask for what's wrong with them, but
Not to
never
this extent.
No, never
Yeah.
motivational interviewing, never talk. No.
Definitely not. And that's where, as been in practice for years, you start noticing these small things and the power words happen.
Yeah.
It's, if you're going to take anything, there's a lot of stuff we're going to talk on here in a sec, but if you even just take that itself, that can change your practice, your interaction with patients, your interaction with your family dramatically.
Your energy.
Oh,
Yep.
hugely. And then I think there's one other thing I want to add on in terms of handling emotional load. As any physician, doctor, someone that's treating people, oftentimes you come across negativity, or I'm still in pain, or this stuff is still going on, losing track of time. Yes, you'll have to deal with that and have a general understanding of how to have those conversations, but just the same, anytime you have any small wins, people are better, symptoms are improved, you have to celebrate that dramatically.
Heck yeah.
Even if it's small to them, you as a provider, again, words matter so much. You have to put that on a huge pedestal, which will help for their dopamine cycle, yours, to look at the positive many instead of the negative few from there.
And funny enough, too, I'm sure you've noticed this as a provider, even some of the listening, how patients forget where they've come from, too.
Yes.
And so sometimes you have to celebrate it. You have to show them what they should be celebrating.
Yes.
Too, because sometimes they forget where they came from, and they're like, I'm having a rough day today, XYZ, and you're like, what about back here, man? Don't you remember when you first came in? And then they're like, oh yeah. So then those kinds of conversations need to happen too, because you don't want them to get into this feeling that no change was made, even though an incredible amount of change could be made. But as humans, we like to always push for more, and sometimes we forget where we came from too. And everyone can fall into that as well.
Really well stated.
Yeah.
Okay, so from the patient side of things, we know that. Now let's say underlying stressors from just even running a practice. So I know for both of us, running a medical practice, when there's multiple other people involved, there's other finance and team dynamics involved as well. There's a lot of different ways that you can go about this. As in terms of tools, I usually, and this is where I set up, and when I hired the team members that we have, I wanted to make sure that everyone had an underlying purpose, a same purpose, and that was to help as many people as we possibly can. Once you have a foundation with your team and having that, on any of the stressful, tough times, you can always go back to that foundation and then build up from there. So yes, there's going to be times if you're running a practice, a medical practice specifically, to where there's going to be some lulls, there's going to be some things that will happen just naturally in your every week, potentially every month, as you continue growing and expanding your reach to help out your community. But the biggest thing that when I look at handling the stressors from the business side of things is go back to the foundation, do the things that you do really well, and making sure your team works as a whole will have huge implications long term. And yes, there's going to be financial stuff that more than likely for most people that come on board, but handling those tough conversations, if someone's not carrying their weight, you're going to have that conversation or find someone that can handle whatever that task is that you have.
And I think it'll only get worse the longer you wait to have that conversation.
So true. Even though I know for both of us, we hate having negative conversations. Myself specifically, my mind attitude changes when I have to have those conversations, and then coming out of those conversations has been difficult. It's getting easier as time goes on with more experience.
For sure.
But I think having that and just even prefacing that conversation that this is going to be a tough conversation. There's some stuff that we have to talk about, bring up the facts, bring up what you've noticed, and then a game plan of how you can more or less move in the direction you want to move.
For sure.
There.
I love that. I love that. And as I've ran other clinics and now currently another clinic in Phoenix I'm taking over, what I've learned, there's definitely more than one way to lead. And some of them are way more proactive. Some of them are, I would disagree with certain tactics too. For me, micromanaging is always difficult. And it's difficult on your staff, whether they tell you or not. Some people like independence and autonomy. So, you know, that's another one. So that I would, if you struggle with that and if that you like that control, I would recommend you look into systems.
Yes.
I think systems is a great tool for micromanaging. Train systems, you have that confidence and prep to not have to worry. And if you feel that you are a micromanager, maybe you're not as confident in your system. So maybe just relook at that. Secondly, just respect your staff members' time. They need their breaks and time to recoup from the patients that we all see. And sometimes they just need some time to themselves. Also, they don't want to stay an hour or two late after a chaotic day either. So let them leave when you probably are staying after working as the boss. It's a little bit different, but they respect their time. And then lastly, I think one of the bigger ones that I've felt over time is always addressing their concerns as soon as possible. And you touched on that as far as like having the hard conversations quickly. But when I say it, what I mean by addressing their concerns is you don't always have to have the answer right there, but be like, you know what, you're right, but here's what we need to do. And let's at least schedule a conversation to talk about this. Not, I think you should just do this, because maybe that's not the answer. So give yourself some time and just be like, you know what, okay, you're right, I'm sorry about that. Or be like, hey, you know what, you're right, great, thank you for bringing that to my attention. Can we do this on Tuesday at this time? Let's talk about it, and then let's see if we can't take care of it. Right there.
Perfect.
And I think then they feel heard. They know that you very quickly came up with a solution to help them. There's no lull. There's no wait. You addressed it right away. I think they respect that. If you do that with your staff and your patients, I think you're just going to have a lot more cooperation, a lot better flow, and I think it just ultimately is going to be more helpful, beneficial, mental-wise for you down the road. Not having to put out way more intense fires.
Oh gosh, yes.
Just putting out the small ones. They're going to pop up. You're not going to avoid them. I mean, they're going to happen. But put the small ones out quick so they don't get big.
And it gets easier with experience and time as well too.
For sure.
I know we both attest to that. And then the last point in terms of understanding the stressors, this is one that I still struggle with here and there, setting boundaries, and even from like work to life, like personal life to work balance is challenging. The better provider is, the better they are. Usually the worse the work, the personal life relation
I agree.
dynamic usually is. So I think it's good to have a general understanding. If you have a significant other at home, to understand what are the barriers and parameters that you guys as a relationship, as a family, want to work around. Meaning, if you have a bunch of work, keep everything at work, or if you have to get stuff done, small specific time, and having that communication early on that I have to get this done, there's a deadline, and making sure everyone's okay with that. Ideally, letting them know more in advance is a little smarter, but the boundaries portion, keeping the personal life and work separate to a certain extent, the best you possibly can help for the long-term basis, because that way you don't take stuff home, you don't take the stress home, which then bleeds into your family, especially if it's more negative. I know we've seen that. My wife being a nurse, there's a whole side of things there, and then even myself as well too. Having a general understanding of, yes, there's certain things that you can work on, but can you find other time to work on either patient's cases outside of your personal at-home life, whether it's not working on the weekends, stopping at a specific time at night when you come home from work, or just working extra after you get done seeing patients and finish everything before you leave the doors of your work, and then go home with a clear mental mind.
Yeah, no, I completely agree with that. There are times I've worked 100-hour weeks and 50-hour weeks, and I can assure you which one was better on my mental health.
Yes.
Now, did I completely enjoy and love what I was doing in those 100-hour weeks? Absolutely, because there's a reason I chose to work that much. And that was starting out, and I was finally got to practice, and I got to do everything that I wanted. And so for those who are starting out, I know medical residents work 80 plus hours a week from the get.
Yes.
And I know I've read studies showed that they're okay receiving no pay to work that much because they just want to help people. And if you look at a medical resident's salary from the start, it's 30 to 40K, and that's a doctor. As a doctor, they're working those hours and they're not bringing home that much, and it's just because they love what they do. They want to help people. And so I know you want to hit the ground running, but if you can just manage that from the start, you'll be so much better at it a few years down the road than hitting a wall and then having to figure that out once you've hit that wall. From perspective, take from my experience. What I wish I would have done was put more of that time into figuring out a self-care schedule, a relationship family schedule, and I had boundaries with myself, which meant no is no, and scheduling things instead of choosing to do the work. Yeah, I think a lot of providers probably struggle with that, business owners in general, who not only have the job of caretaker provider, but business owner, finance, and then leader, tax figure outer, and you keep a lot of hats.
So much.
A lot of hats, which means a lot of time to for all those parts. So we get it. We totally get it. Just make sure you're going to at least give yourself 1 to 2 hours a day of intentional time to work on yourself, whether that's in the gym, whether that's in a meditative state, I don't know. But your body will thank you.
Yes.
Mind will thank you.
Yes. And I'm just going to put this out there. You can get ahead rather quickly by sacrificing your personal life.
Yeah.
I know I can take that, I can speak based on personal experience. And when you look back at it, for myself specifically, I don't know if it was completely worth the sacrifice. So that would be one regret I probably would want to take back. But at the same time, I learn from the experience and not as much focusing backwards, but more focusing on present and future, on what you can do to impact what you have already worked towards thus far.
Yeah. And if you're going to make those decisions, you got to understand the consequences. And I'm not saying that's a bad thing.
Yes.
You're going to probably make a lot more money and gain and grow quicker sacrificing that. And that's ultimately what a lot of people want in life, and I get that. And you got to understand where it's, instead, I want to keep my mental sanity, and I want to keep my relationships, and I want to, but I might not grow in that section as quickly as I would have just. Anyone can succeed working 100-hour weeks, man. You're going to outwork everybody. But once you get to that point in time where you meet that road and now you're burnt. And I like 100%. That you brought that up. That's a very good point.
100%. Now, as we understand the stresses, it's important to understand what tools you can do outside. I know we brought up a few already, but these I wouldn't take lightly. You probably hear some of them and you're like, okay, I know about this, but actually trying the action of doing some of these have huge implication long term, because we hear some of this stuff on a daily, weekly basis. So the first one would be regular mental check-ins. So that means reassessing yourself on maybe the drive home after work. Where is some stuff that you may have done well, where is some of the stuff that you do as well that you would maybe change, and then whether it's just thinking to yourself, speaking out loud, and you're not talking to anyone, just speaking it out of your mouth will have a relaxing, calming effect. We're seeing this with any of the therapists as well. So that would be one. Journaling would also be another, but take a peek at, and just even if you don't want to speak it out loud, if journaling is your thing, trying to write down maybe some of the stresses you have in a journal at the end of the day, or some of the stuff that went well. Again, after each day or after each week on like maybe a Sunday, or starting off on Monday morning. But then again, there's that boundary. So making sure that you're able to separate those two in those time frames.
Again, it's celebrating the wins.
Yes.
Kind of like you already talked about, which is now for yourself.
Yes.
Yeah.
Absolutely.
Yeah. I loved the therapy, helped me out a bunch through, those times where I was incredibly in it and needed to decompress and, like you mentioned, dump some info, dump some things that I'm still holding on to. So that was a great way to do it because I didn't know how to do it yet. So as I've learned over the years how to help myself with that, I haven't necessarily had to rely on therapy, but I was grateful to learn those tools from them because they know what they're doing. And yet journaling is a good tool that they mentioned for me. I like mental check-ins because I actually do that all the time. I figure out, okay, a good example would be the other day, a couple weeks ago, I started having these just way more negative thoughts and it started to spiral down. And I've had some dark paths, like I'm sure we all have our dark, what's
Times,
it called?
maybe?
No, what's the word? Passengers, there we go.
Oh, sure.
We all have our dark passengers, but I had gotten to that point where I had really gotten to this like negative loop, and I'm like, oof, whoa, nope, I'm stressed. Like I know where I'm at when I get that
Recognize.
low, and so I'm like, ooh, nope, okay, what do I got to do here? And so that was helpful because I'm always cognizant of that now because I've been in those places. And so when I sneak down there from a stressful day or a stressful week, maybe 2 weeks, you got to be aware enough to be like, oof, okay, no, I can't be thinking like this. I can't be putting that pressure on myself. So that mental check-in portion of the proponent of things, I love that. That's awesome.
100%.
Yep.
And so I know Doc said therapists, I would strongly encourage that. Even any coaches that are in your either same profession or have experienced similar situations that you typically do with whatever provider you are is also important to have understanding that everyone is going or has gone through certain situations that you probably have already been through. So knowing that you're not alone in that situation is strongly important. And then I think another one that I do on a consistent basis, it would be a type of walking meditation to where you get outside, you're physically walking, so a little bit of exercise on that, and just zone either at the farthest point and then zone to the wide as you possibly can look, and just going back and forth or just zoning outwards can help have a calming effect. So anytime you're able to get out, walk, just get out of the situation, just have your mind go blank, and certain situations might come up, but recognizing and understanding those situations of maybe the stresses of your everyday life and being okay and content and letting them pass by as you walk too helps.
Absolutely.
So that's my usually big go-to on that one for my mental health and de-stressing myself there.
Yep.
But, yeah.
Yeah, I like this next one, Doc, creating a support system. That's been a night and day difference. Having individuals to rely on and continue to rely on through whichever types of issues that you're going through. But I didn't realize how much having a team who had a similar, like you said, mission, vision, also having colleagues who are on your side and are going through similar things as you, or it's meeting other individuals, maybe not in the same profession, but who have the same belief and understanding, and it's fun to share things with them. And this podcast has been fun for us to get to learn from other people, and that's been so much fun. But I think that not only for as far as mental health support, but actually creating a support system of networking or provider network. And I think that one's been a lot more, as I've gotten farther into practice, I didn't really understand how crucial it was to have other providers on your side when patient cases were getting tougher. And for me, I absolutely think you should be taking time on the side to go and meet with other providers and talk to them, text them, call them, network with them. And then once you feel that there is a good setting to make that introduction easy for the patient, for the provider that you want to work with. Say, hey, I've been talking to so-and-so. This is what they are expecting. I've always just made it easier when I'm referring patients to really make it simple for the provider to be like, hey, I'm sending so-and-so to you. This is their number, and this is what they're going through, and I really want this and this. And again, to have that help when we maybe aren't able to get them what they want, like you said, threshold-wise there, that's been crucial, and I really tried hard to build that network much more as I've gotten farther into practice.
Yeah, and looking back, this is such an important one. So if you're a new physician, doctor, so important. I'm not even just talking chiropractors. I'm more speaking to medical doctors,
Yes.
DOs, especially having a general understanding of, okay, what are general presentations that your typical or broad range of typical patient would come in symptom-wise, and then having a good understanding of, okay, there's certain tools that you have maybe from a drug standpoint, but what are all the things available there, the possibilities that could also help them from the holistic side of things. Acupuncture, how could that help with this condition, with these symptoms? Chiropractic, natural medicine. There's just so many things that I think if you have more of an understanding of how each profession, type of specialty, physician, doctor works,
Yes.
you'll have a better understanding of, if you're not able to get this person under control, this person would be better. Or, and then like you said, building up the network, having someone that you trust or that you know has really good results with certain conditions is so important. So I physically look for physicians that have a general understanding of multiple scopes of practice. I think if you get stuck tunnel vision for so long and you only look through the scope of, I have these tools and they can maybe help for some of these symptoms, maybe not, you're going to lose that battle, and it's going to affect the patient cost, time, long term. It can actually make things worse. So if you want what's truly best for the patient, the better understanding of knowledge you have for more providers and having someone you trust, so important.
Yeah, and what that could mean is going and asking these providers questions, and that's what I used to do. I did. I would go and talk to the surgeon and be like, look, what cases do you usually take on, and what does that look like? Because the last thing, and I've spoke to so many surgeons about this now, so I know this, but they are sent to everyone. Like, the surgery, obviously when you look at a hierarchy of pyramid of care, usually surgery's technically the last ditch effort in most cases, and especially with chronic issues. And so whether providers take a patient through the appropriate courses of care and then surgery, that might be when they receive the patient. Or it's a provider who wants to think that it's, oh, this didn't work, let's send them right to surgery. But it always ends with surgery. So they would tell me that, you know what, we are getting healthy individuals being sent to us because they don't know how to help these people. And so I got to come in the room and be like, sorry, I can't do surgery with you because you're young and healthy. And I don't know why they referred me. But so what they respect is what's a good candidate. And if you can vet for them and at least give them help them with making sure that, because then of course that makes them respected and appropriate in their setting, just like yourself. And it's only going to improve the relationship between not only you and the patient, but the patient and now the new provider, and then you and the provider. And so that was one that I got to learn right away, because when I was young in practice, I was sending these cases, and the surgeon just kept calling me. He's, hey, I appreciate the referral, but I would have sent them this way. And he goes, this is who I usually send these cases to. Do you want his number? And I'm like, yeah, thank you so much. And I was grateful that they did that with me. And it was fun to experience. And then of course that network continued to build. And then as I learned, I got to send him other cases that truly were needed. And when he did, he's, hey, thank you for this referral, this patient. So XYZ, and now they're like doing so good. It's fun to have, because even though it wasn't us doing it, that it's an extension of us.
Yes.
And guess what? Ultimately, at the end, the patient got their improvement. And you got to be a part of that. Because you did. You were the one that had to facilitate it. You could have easily told them, I don't know what to do. You might have to live with it. Go away. How many times patients are told that by these providers who are like, look, I don't know what to do with you. You might just have to live with this. Sorry.
I don't know if I've ever said those words.
No, we've never have. But we hear it.
Yes.
We hear it from doctors all the time.
Then it goes down to the laziness part of things.
It is.
Probably lack of purpose.
We got to be better.
Yeah.
But yeah, it's been an exciting journey of getting to learn more about other providers in the area, who to work with, and who to ultimately gets the best results, and who is ethical
Yes.
in choosing their care and all those other things.
So important.
Yes.
And I think the last one I want to add on, especially with the mental health and handling stress, would be, and I know we touched on some meditation, some journaling, check-ins, but it'd be anything of hobbies, interests outside of your everyday work environment. So not doing stuff, for myself, being anything related to chiropractic. Finding an interest that you have and spending time with that and just getting away from patient care and everything else involved from there.
100%.
Because you have to step away, even though that you're probably zoned in, and that's a huge testament to maybe your life's purpose. You have to take a step back and know what's best for you. But you and most other physicians have other interests. Lean into some of those on the stressful times, and just get out of your everyday situations and responsibilities for at least a period of time at least. But
and if you don't agree with Dr. Jace, I would recommend you watch the Importance of Play podcast we talked about, where we dove 2 hours into research regarding why hobbies and play will contribute to your mental health boost and longevity, really.
I love that.
Yeah.
That's perfect, man. Shoot. Okay, so now we touched on some of the mental health, managing some stress in practice. Now, in terms of body maintenance, through some of this, we'll probably talk to more on the chiropractic standpoint, but this would be same for dentists that are looking down for periods of time, medical doctors that just sit, or even radiologists for that matter, sit and just stare at a screen. There's a lot of awesome tools that I think are important to understand and know that we'll get into as well too.
But body doctors, PTs, they're doing that. I'm sure OTs, other therapists. You can probably take a look at every provider and know that screen time has probably increased immensely over the course of their career. If they're end of their career, they probably felt that at one point in time. Us early on, we got it right away. That's just what we were introduced to. So that is also a huge proponent of what we do. So early on, you're recognizing that's going to be a part of your breakdown if you're doing that kind of stuff a lot.
Absolutely.
But yeah, no, it's exciting to talk about this, because when you start to feel it, and early on, you maybe don't recognize it right away, but now that it's gotten to that point, it's Russ, I want to help you guys understand what that really feels like when you get to that point, and what you can do to prevent it, because it only just improves your day-to-day life when you can train appropriately for this.
Yes, and I know as a physician doctor, there's certain things that myself, I know I'm limited to, because I know if I go into this or if I get injured, it'll impact my patient care. For those people that are listening, especially in the general public or even family members to doctors, physicians, understanding that the risk that you go at of, let's say, random example, bull riding or any type of activity that can have a chance of injury or easier chance of injury, that will be something that you have to take in consideration. So there's certain athletic sporting events that I know I have to limit myself to, or the amount of effort I give to that because of the risk of injury.
Especially if you rely on your body, you're saying.
Yes.
Yeah, of course.
Yeah, so as chiropractors,
I don't know how many docs
tough.
I've met that have got injured skiing.
Yeah,
Changed their life.
snowboarding.
Yeah.
It's just anything, because if once you get injured, especially as a chiropractor, you have to change up how you go about treating, which will impact, like I said, patient care. So that's a whole mental stress that most people don't even realize that they'll have especially if it's stuff that you love to do, like snowboarding, skiing. That's a really good example. It can be draining on a person. So that's just one thing, but understanding, okay, let's look at what are in terms of the daily maintenance for any physician, what are the common activities you find yourself doing on a day-to-day basis? So for chiropractors, adjustments, so that's going to be speed, strength for whether it's larger patients of 300 plus pounds or an older individual that is maybe less than 100 pounds. You have to, from a chiropractic standpoint, you have to adjust them more than likely different, and then do they have degeneration, arthritis, what are the symptoms? There's a bunch of other stuff involved with that, but having the capabilities to help as many people as possible, you're going to have enough strength to address some of those bigger patients. So you're going to need to either build up the strength, have a general understanding of the speed is the thing that helps move certain bones, release these cavitations, these pops that you may think of. So building up the speed, and then what positions are those? So whether it's your hands quickly going down, you can train that. Where the side posture adjustments, if someone's on the side and you drop them on the side, there's a lot of core torso activation. So the chiropractors specifically have a huge risk for disc herniations, for strains, sprains throughout, and then oftentimes they have to work into that if they do have those come up available. So those are certain things that you have to pay attention to recognizing. Let's take, for example, dentists looking down. What are certain times and things that you can do to open things up, or the time when you're not treating that person, how can you bring your head backwards, stretch out the front of the neck between the chin to the sternum, bring and open up the shoulders from closed off in front of you to behind you.
And how often.
Exactly.
And remembering to do it. That's another part. I can only imagine surgeons who have to stand and look a certain way for long periods of time. I remember, this is not only with a case that we had managed together, but I had a case too of researchers who have to look in microscopes, and you know, just these disc issues that they get because of how much chronic flexion that they are doing. Like you said, dentists, surgeons, I mean, you name it. When it comes to kind of torque on your neck, you got to be able to preserve that joint health, and it comes from day-to-day management. You can't just work out once a week or maybe a few times a month and expect not to have, unfortunate, an event like that, especially if that's how much strain you're putting on the body. And I like that you brought up, like, when it comes to what are you doing, what activities are you doing, and we've done a good job of breaking down certain occupations and typical activities and movements that they're usually doing. And so I would put sitting probably as the main activity for a lot of providers. Secondly would be standing, probably for long periods of time. Us PTs maybe working with patients, surgeons.
Head positions usually down as well.
If you're working on a sit-stand desk as an MD, talking with patients, maybe writing if you're typing. Other than, it's funny because we're the exception, other than maybe some other doctors who who do a lot more body work, massage therapists, things like that. It's more lack of movement for them too. And now it's a matter of how often are you getting up and actually moving, and how often are you even taking your joints through a full range of motion, and how have you done that today? You're 6 hours into a shift. When was the last time you moved your neck into a full range of motion? And so I think that is even a lot more helpful for those of you that are understanding what to actually do to manage the breakdown of these joints. And we're not asking you to go and rep out 20 huge neck extensions on the cable. Not to say that wouldn't help, but sometimes it's just a matter of remembering to move versus letting yourself stay so stagnant for so long periods of time.
Very true. And easier said than done.
For sure.
I think a good general rule when thinking about most physicians, doctors, would be to work out your back 2-to-1 ratio versus your chest or in front of you. So you're able to strengthen, able to hold the pressure against gravity when you are working in front of you for longer periods of time. There's more specifics with that, but I would say the 2-to-1 ratio back versus chest workouts is important, and then targeting any of the areas that you often neglect. So when was the last time you worked out your neck or muscles in your upper back, to hold your head back up straight? Like when your head weighs as much as a bowling ball and it goes farther and farther forward, it puts way more stress on the upper back, which then can lead to compensations downhill from there. I think for chiropractors specifically, rotational work, training rotational work in different angles, whether it's facing downwards or extending so you face upwards with rotational work, is also really important. And then monitoring breath work. So when you go into rotational movements, you're able to, for some positions, take a breath in, open up the space between the ribs, intercostal space, then go into rotational work, because the more time you spend forward in front of you, the ribs will start collapsing forward, and then there's rib problems, there's other muscle compensation spasms that can work up or down.
Yep.
So those would be a few specific things I would look at from there.
I know in research, chiro, the first thing to go is the back or the shoulder.
Yep, usually.
And so we know that's
Yep.
going to be an area of the body that you need to put some extra time and care into. And if you're not, I really hope you don't have any further issues with those areas. But
Even if you're not in pain too,
Exactly.
it's even more important.
yeah, prep work and
Yes.
maintenance for sure.
100%.
So Doc, I know you have some more helpful routine, we'll call it routines for
Perfect.
these individuals that are not only either working with their body or they're just working in a stagnant state and that's just tough on their body. But what would you say importance-wise, like ergonomics of those individuals who are sitting for these periods of times, having to do chart notes, radiologists, those kinds of things? Is there anything that they can at least try tool-wise to improve?
Yeah, I think you almost have to break down each body part and then plan out either a time in your day or every couple weeks to target that specific area is going to be important. So in terms of sitting for longer periods of time, you take in consideration common muscles and areas for most people are going to be hip flexor tightness, which then can lead to upper lower body cross syndrome. More or less, it's just excessive rounding of the lower back or head coming forward in a forward posture position. Those are common. So you would want to start joint work for the spine and work out from there. So then you'd look at the shoulders, the neck. That goes into the strengthening aspect of the neck in certain positions. I know we've said this in previous podcasts as well. If you're having headaches, especially if you're looking or sitting for longer periods of time, there's a muscle on the front of the neck, deep muscle called the longus colli. If you're able to tuck your chin to your chest, hold that there, it then opens up the space between the back base of your skull and like the C1, C2, the next segments down in your neck. That will thus subsequently help hugely with tension headaches. So there's another one in terms of just holding your chin to your chest, ideally laying on your back face up against gravity. Once you know your chin, come untucked, relax everything from there, because then it forces the SCM to compensate and take more of the stress and load. So that would be a good one. In terms of lower back, sitting for longer periods of time, most people have a tendency not to go into segmentation or move one bone on top of another in terms of bending forward. So it'd be, you would want to either round your back for some muscle contraction. So if you want to look up what's known as Jefferson curls, or we have something known as sagittal segmentation, to where you're just rounding your whole spine slowly, one bone from top down and bottom up, as slow and as best control as you possibly can. Has the best signaler for some of the deeper structures, which subsequently helps turn off overlying muscle guarding over a period of time from there. So that's why I tend to go for people that sit for longer periods of time. And then add in rotational work, especially if you have a tendency to sit and lean to one direction for a period of time. Rotational work for the rib cage and anything core to extremity movements, or your torso to your legs, arm movements, will also help break apart some of the muscle guarding tightness that can occur from there. But stretching helps, but you need muscle activation for the brain's communication down to the tissues.
Yeah. And I know you've talked about a couple of things. One, training in multiple planes.
Yes.
I love that. So making sure that you do add that rotational work in there. I think that's great. That's helped me a bunch as I've continued to try to boost myself in certain areas. And then number two, I would say when in doubt, load the tissue. And what I mean by that is when you have a good 2 minutes to stretch, maybe instead of stretching, do something to add an incredible amount of resistance to the tissue. Now, I know you maybe don't keep 60-pound dumbbells in your clinic, and so that might be tough for you. But let's say, for example, would be you're having like CT junction pain or your trap pain. A lot of people hold their stress there. I know what I'm talking about. Instead of maybe adding just general static stretching into it, can you put your head up against the wall and just force and just push as hard as you can. Add some rotation into it, push as hard as you can. What I usually do is I pick up 60-pound dumbbells. I just shoulder shrug, 30-second holds, and let go. What you find, that thing will relax way quicker than any static stretch that you can do. And so not only is it how to, but it's can we be efficient with our time?
Yes.
And those are going to be the concepts we've obviously talked about over time is if you only have this time, what can you actually do to give you the best results?
Yes.
And I've found when in doubt, load the tissue, such a great way to relax tension, tight areas, and the isometric holds that you've talked about to really target the tissue,
Yes.
actually improve tissue health, not just static stretching, which we've now know it's just not as effective as those other.
And there's, I think, one thing that, and I don't think we've ever touched on before, is taking a page out of some of what's going on in the Chinese culture and how they're brought up from a physical education standpoint. There's a lot of bounding, hopping type movements. So when you look at the body, if you're feeling pretty good or if you're having maybe these slight twinges throughout, I would go and try either jump roping or just like hopping on the ground. I'd probably start 2 legs and work on one, which will help for shock absorption of the discs. It'll also help for a little bit more gas exchange in the joints as well, working out from the spine outwards. It has a huge implication on recoil for the plantar fascia on the feet, and then even to any joint up from the foot from there. I think that can help quite a bit for most people.
Love that.
That would be something that definitely should get worked in. So in terms of what Dr. Addy was saying, working all planes, there's a sagittal plane forward and backwards. There's a frontal plane, like side to side, a transverse plane in terms of rotational work. And then there's also a plane that often it really doesn't get taught too often. It's like the Z-axis, so moving up and down against a surface or a plane. So that would be bounding, hopping, but making it safe as possible, whether it's you're getting up on your toes and just doing some bounding, both feet just nice and easy, or you can get more dynamic in terms of working in other planes with bounding as well.
I love that.
But yeah, something a little different. But
I don't think you've touched on that.
probably not.
So that's cool.
Yeah.
I think that's a great assessment more for the daily. Is there anything, once we are able to start doing things day to day, obviously those of you that are going home after work, working out, or even prior to work, now you're having more time to really put yourself into a good state of exercise, resistance training, yoga, whatever you want to do. Doc, do you want to touch just a little bit about some things or types of either exercise types that they should be hitting, things an overall maybe conditioning standpoint, but then also different areas that maybe you should also be targeting? And I guess that'll just be dependent on the physician too. I know us will be different with speed work and those kinds of things. But do you want to just generally just go over that strength and conditioning kind of routine, and what's a good place for them to get started?
So I would start off going back to assessing what your common everyday tendencies are. Obviously having a general understanding, what positions does your body have to go into for longer periods of time. So then you start thinking, okay, if my body's in this position for longer periods of time, automatically type 1 muscle fibers, their type of muscles that are activated are able to hold positions for longer periods of time versus the type 2, which are the fast, explosive type muscle fibers. So you can pick and choose what ones are common positions, build up strength around whatever position you are finding yourself in. But let's say, for example, actually, I do want to go to this direction. For chiropractors specifically, touching on a part that most people don't think about or negate would be the hands and the rehab and the general maintenance there. And then I'll go into the brief overview of strength and different other avenues we can touch on with that. But in terms of hands, general maintenance, especially if you're working dexterity-wise for chiropractors, physical therapists, there has to be a maintenance, whether it's monthly, weekly, daily for some individuals, to prevent arthritis buildup. So there's a few things that you can do to start with that. Either one, you lengthen the joint or you decompress the joint. So you can just start off by decompressing, pulling your finger. You can add in rotational work. It matters where you pull and decompress. So if you start at the fingertip, you're going to decompress multiple joints versus one at a time. So rotational work, decompressing, very nice, light and easy. There shouldn't be sharp pain. If so, rotate in the opposite direction as you're decompressing. If you start noticing like your fingers are going off directions, you decompress and then you activate the muscles either on your forehands, wrists, flexors, or extenders as you're decompressing. So not only are we lengthening the joint, but we're also signaling for the tendinous properties that attach to specific parts of the fingers. Will also have a better connection neurological wise, but then also for blood flow, gas exchange, which can help for arthritis and motor function as well. So I'd have a tendency to go there. And then also for proprioception, so bringing your thumb to each finger, work in circumduction or big circles of the thumb, in and out, flexion, adduction to multiple fingers will have a huge implication for rehab health for all the fingers together and separate from one another. Add in adduction, abduction as a whole, and then more importantly for most people that are gripping, that are writing on pens, would be extension work. So opening up all the fingers, extend your wrist backwards, and then ideally, I know we brought this up previous, to where you then open up your arms. So we're starting at fingers, we're then going to elbows, and then we're going into arms, shoulders, and then you can go into upper back, spine. So more or less, you're gonna have a wide hand, fingers are open up as much as possible, straight arm, arms back, and then you can add in rotational work for the shoulder, which addresses everything bottom up from there. That would be a way that you can target multiple different small specific areas from the fingers all the way up to the whole body arm. Now let's say we want to target and build up the resiliency long-term mobility practice of moving, like Doc said, all the joints from the neck, the biggest range of motion, pain-free possible, or the workspaces. I know we've touched on this so many times. Having that as an idea, but also any other areas of injuries that maybe are lingering or that you continually re-injure, if I may. I would start isometric contractions or squeezing whatever or contracting any areas that constantly get re-aggravated, whether it's in your lower back, whether it's your neck, whether it's a finger, specifically hands. And then you can vary the intensity in which you contract those muscles. 100% in your max squeeze contraction, where you can, as much as you can master or muster up, versus maybe light 25 to 50% intensity. So any injuries, we start off with isometric contractions, but working in 5 seconds on and off contractions throughout your day. But let's say we want to build up the strength and resiliency. That's where you then want to add in, like Doc said, add in load, add in weight. In addition to that, you also want mobility practices. So I'd work in workspaces as a warm-up, and you can in between some of the exercises as well. And then from there, in certain phases, you usually want to start off with hypertrophy, so you build up the density of the muscle, which is more reps and sets, lighter weight usually, and then you would add in strength. So you decrease the reps range to anywhere from 6 to 12 reps or so for whatever exercise you're doing. But let's say, for example, you're doing bicep curls, okay? Maybe you're working specifically on the plane in the middle part of your bicep. So are you able to rotate your hand outwards? Are you able to rotate your arm inwards so you get different lines of strain to the same muscle belly? So that's where a type of variability plays. So just have a general understanding. If you do the same type of workout over and over, the muscles will overpower the connective tissue, usually tendons, which can create injury, sprains, strains from there, and then it's a downhill cascading effect for compensations. So hypertrophy, high reps, low weight, you then build up a little higher weight, you decrease the rep range to anywhere from 6 to 12 or so. And then if you want to add in from there, and as you're transitioning from hypertrophy to strength to power / speed, you want a good probably few days, solid week in that transition so your body can offload and then start building up from there in terms of how you periodize your training cycles. If all this is new to you, most trainers will have a general understanding with this. But let's say you get through the hypertrophy phase, you get through the strength phase, and those phases can last anywhere from 1 to 3 months or so. And then you want to add in power speed. So you would back off the weight, you would increase the speed or intensity, and that's where most, especially chiropractors and most physicians, should make sure you tackle, because the older you get in age, the speed starts to diminish. The quickness and explosion starts to diminish significantly after the age of 60. So working into that, your training cycles will work really well there. And specifically for chiropractors, maybe not in the common way in how you adjust someone, but maybe working in the complete opposite way. So with your arms backwards and quick twitching movements as everything's lengthened going backwards behind you. Start playing with certain situations there safely. Whatever movement you can move quickly and pain-free, I'd start there. And then start to explore a little bit, and then you can add that into your everyday practice as well too. But yeah.
And this is just off the top of my head, but you can even also put some gamification into it and maybe make it fun. Jiu-jitsu martial arts are, I know, incredible with reflexes and training and those kinds of things. I feel like golfing and baseball would be a similar explosive movement. It's just off the top of my head. But yeah, there are other ways that you can go about training those things too. But it's doing those consistently and making sure that you're staying on top of that is what's going to help.
Yes.
I think power speed basketball is going to be probably a great one out there. Pickleball, maybe some reflexive work.
It's good too, coordination.
Yeah, absolutely. And I think, you know, what works best for you, but staying consistent and making sure that you're doing those as consistently as you can, that's where you're going to get ahead, especially when it comes to the body. But that's awesome. I know most providers who get into a healthcare setting, and it might be different compared to you know, where we were at versus other maybe medical residents who, you know, get into a big system, big hospital. I'm sure, you know, you can make your assumptions there, but I know that if you aren't sticking to what you believe in as a provider, it can get quite draining for you. If who you work for or how you work doesn't align with what you think. And Doc, I know that this is something that we've talked about a bunch, but why do you think having your why is so crucial to continuing to treat patients and not letting the day-to-day, I guess, powers that be maybe dictate or manage that energy that you have and what you're trying to give to patients?
Yeah, I think if you have that mental intention to naturally have a way to help other people, and you have a strong, if we will, why on why you're helping people, any stressful situation you can come up against, you can always fall back on your purpose, your why, and why you're even spending time, why you went to school, why you're even helping people. Once you have that foundation on that sacrifice you're making for the greater good of other people in the community, it'll have a better compass of where you can point you to. Let's say where the time is limited, interactions between patients is also limited. There's a few flare-ups from patient to patient, knowing that if you're able to give them as best care as you possibly can with the time that you have and being okay with that, subsequently it will have a calming effect, but more or less that you're trying to do everything, your power that you can to help them. And then as you get better with that, you can find other small tools, different ways to communicate with that individual with that small bit of time that you have too. But a lot of that will come back to, why did you even start with this? Is it just because of the money? Money is necessarily, if you are a doctor and you're in this profession for a longer period of time, you're going to soon find out that you're going to get wiped out mentally rather quickly.
For sure.
Yeah, so
100%.
then it affects patient care and everything else long term.
100%.
So having a strong why on what you're doing, why you're spending all this time to help others, and to constantly being reminded of that has better outcomes long term, not only for patients, but for the physicians
100%.
as well.
That's awesome. And I think those of you that have that internal want to help others, I think this is the profession. This is a profession that you're usually, drawn to. And now it's what can you do to make sure that you stay on that course.
Fireworks.
Interesting. So it helps you to stay on course during your career, because as you continue to get better as a provider, and you might change systems, you might change companies, you might change. What eventually might end up happening is you can get swayed by certain individuals or practice types or management types or even things like that, where they're really good at changing your why. Because I wasn't going to say it, but pharma companies and reps and people selling things, and of course, if you're in the thick of it as a business owner and you're looking for an option to keep your head afloat, it's easy to get drawn to a different why. And so it's not to say nobody's perfect. We get it. So what we're just trying to say is, when you are really sticking to why you chose to be a provider, which I think most, if not all, did get into this profession to help others. If that's your driving force, like Doctor said, to fall back on that when times are tough, it just gives you perspective, and it allows you to weed through the tougher times, and eventually, and I'm serious, I'm not just saying this, when I tend to look at the numbers, my numbers drop. When I focus on how to help patients and improve care, and I'm only focused on that, my numbers go up.
Yeah.
And I'm telling you, since I started doing this from day one, I've even worked with doctors that's who I learned this from, and they're like, Doc, I'm telling you, we're not even going to look at the numbers right now. We're going to look on how do we make every single patient who walks in this store's day better and their lives better. And that's what we're going to talk about. We're going to game plan. We're going to prep that, and that's our meetings that we're going to talk about with staff, and that's our goal. And I'm like, great. And by and large, that is what drove our patient amount up, and clinic, space grew. And I'm just like, it's cool to see that kind of law of attraction. And so you don't have to worry about the financials so much when you're worrying about how to help people. It'll just naturally come to you.
You can't say that any better.
Yeah.
And I 100% agree.
Yeah.
Yeah, I think earlier in practice, especially for myself, I think it's important to know certain numbers, but not to get fixated or stuck on them on a day-to-day basis.
Right.
If you can have, like Doc said, your mental energy on what is going on with the patient, how you can best help them, everything will fall through
100%.
with itself too. So really good point. And then I think one other thing to help for the intention would be to give back to whatever profession you are in, chiropractors, medical doctors. Share the knowledge and experience that you've had, whether it's social media, whether it's one-on-one interactions, group setting, will only have a better effect for you long-term. Maybe sharing, okay, these are things, and being humble with this, that didn't go well with this patient, with these symptoms, and being willing to ask, okay, what have you done? Or maybe talking to a different physician, what's a better route that you could take?
Yep.
But that has a level of humility that anytime you have a doctor in front of your name, most of them that I've come across and talked to that are not as humble as they should be. And that's a whole stigma that it's an uphill battle.
Yeah, of course.
From there,
of course.
Yeah.
But I agree, and as I've gotten more and more into practice, it's been more of a focus for me to help other people too, and because I remember what it was like to call those other providers who took their time to help me, even outside of the profession I was in, and I just remember those times, and so now I'm going to pay that forward, and it's a very good feeling that I was able to help other individuals, providers, so. Yeah, I think it's just what's going to create a better healthcare culture moving forward, and it's what's needed. Teamwork, integration, and just helping each other.
100%.
For sure.
I love that.
So
let's go.
Lastly, we have additional strategies, we'll call it, for career longevity, but the big one for me, ongoing education. I can't
really
talk
like
more on this, but those of you who are a learner and just thirst for knowledge and growth, maybe will resonate more from what I'm about to say. And some of you just maybe don't have as much want to read and learn and grow. And it's not that you're not growing as you're practicing anyway. So I get that. just by doing your job, you're practicing. That's what it's called. So I get it. I get the extra stuff on the side if you have a family and you've chosen to that be the extra part of your days. Perfect. But I've found that ongoing education is what keeps me lit up, excited. And for me, that's usually seminars that aren't covered by don't have continuing ed credits. Some of them do, but by no means am I saying don't go to those. But I tend to want to learn more about the newer things, cutting edge things, and it just happens to be a lot of the times when you go to those seminars, they don't have any actual continuing ed credits available. So it's all usually on top of the regular credits that I have to get. But what I've found is, man, going to those things that you're interested in and you want to learn about, and that's something that you're excited to read more about, that's what's going to continue to fill your cup. And so I have spent many a times to travel outside of my practice and go to these seminars and learn from other providers. And it's fun to actually experience what they're going through, but also how they run their clinic and get to network and talk. And that is also a great way to break up the month, maybe the halfway through the year. It's a great way to continue to build yourself and what you know, and your patients love it because it shows that you are the kind of person that is always looking for ways to help them, and they respect that. And trust me, I've heard this from them. That's why I'm saying this. They appreciate that you can bring them new things to help them, and they appreciate that you go out there and try to find other things to improve their lives. And it's not a waste, it's only an investment. And I recommend that if you have something you're interested in learning about, dive in.
Yes.
Dive in, learn, and if you can't get enough, perfect. Discontinue. But yeah.
I love that.
Yeah.
And there's a point that I'm going to make here that I don't know if I've ever talked to you about by chance, but no, to finish the point that you brought up, continuing education I think is incredibly important. As physicians, we're required, most of us, on either a yearly or bi-yearly basis to complete so many credits to continue to have our license.
Yeah,
so just as for the people in the general public, every practitioner has something like that available or that they have to require to complete. But when you look at learning different tools, learning different things, when you look at the broad scope, and this is where, when I was early on in my career, I wanted to know what other practitioners were doing, not only just chiropractors, but MDs, like naturopaths, like any type of practitioner. So maybe you start diving into what does this provider do, what are the common symptoms that they do, and then there's certain symptoms, presentations that patients that they usually see. So maybe dive into that for whether it's a couple weeks, a couple months, having a general understanding that you want to look at more different avenues, but dive down that rabbit hole as best as you possibly can, expand your knowledge, and then make sure to take a broad overview scope and take a step backwards to dive down another rabbit hole, broaden that scope, take a step back. So you have all these different rabbit holes that you've been in, and you have a general knowledge on many different things, whether that's ozone therapy, whether that's dry needling, whether that's certain types of therapists that focus more on like mental health. The more tools and understanding that you have of all the other disciplines, most other disciplines in the medical practice, will have a better understanding of different ways that you can help people.
Yeah.
That's I think a very important step that most, if not all, practitioners should have a general understanding with.
Absolutely. The way that I learned how to communicate with patients wasn't from continuing ed credits or school.
Yes.
It was studying psychology.
Yeah.
Something that we didn't get a lot on. And it was studying communication. It was studying those who could communicate, in my opinion, positively and constructively. It was entrepreneurs who just are good at talking. It was Gary Vee telling us how to run a business and how to be nice to people and kind. And so that's not even in our continuing ed credits. It was going out and just learning from others that you may resonate with, and then just continuing to consume that knowledge until you found to be maybe bettering yourself. And so I like that you brought that up because that's so true.
So needed.
Overall sharpening of the sword. It's making sure you are sharp everywhere.
Yes.
For sure.
Always be curious.
Yep, I
would
love
be
it.
what I would
Yes,
say.
I love that.
Yes. Ooh, well, I'm excited about this one. Doc.
All right.
Workplace environment. Now, we can touch on this and probably for quite a while, but I'm actually curious. So when you took over the Phoenix location, obviously it's different than probably many other clinics that you've ran or worked at. When you look at the workplace environment, you have to look at in terms of obviously how the patients are moving through the practice, but also how everything is moving as a whole. Is there certain things that you look for, how to optimize either patient flow or the interaction for the care of patients
Yes.
with workplace
Yes,
flow?
and it's funny, I just talked to a staff member about this yesterday.
perfect.
How do I keep a pulse on my clinic? I listen for laughter. That's it.
Yes.
I'm telling you, that's the first thing I do. If I'm stuck in doing notes and next thing you know, I'm just see, oh, how's things been? If I can hear communication, laughter, if I hear positive effects in their tone, you can pick up on that. I know that the culture that I've created is a win.
Beautiful.
And I know that positivity is going to shine into my patients from my staff, and that is only going to benefit my patients. And so when I can create a culture that allows for happiness, positivity, people that are able to be themselves, they feel like they can have the independence and trust from the person who's helping them, managing them, what have you, what you call it a boss. It might be different in certain settings, but that's where you're just going to get more of your staff and you're going to get more out of your business. And you're going to have to call it a business sooner or later because that's what it is. When I come into a place and maybe it's, let's say I got to go to the dentist or I go to any place, and you can, like we've talked about, you can sometimes, some people are just better at feeling energy than others, but I can feel that. I can feel that. I can feel how the staff members communicate to each other. I can feel it how they communicate to the patients. And if I'm a patient, I can pick up on that and it's, oh, this is weird, or, oh, this is great. Love the energy. And it translates. That translates. So number one, is there laughter? Is there joy? Is there positivity? And I would say then maybe 2 and 3 would be, are individuals comfortable coming to talk to you about hard conversations? Or are they comfortable at least hearing what you have to say about hard conversations? And so how you word that, and already the experience that I've had has been great because they've come up to me with all these things that they need to talk about and problems to try to solve and all these things. And hey, I just know that I've created that for them. They're comfortable coming up to me knowing that they're not going to be getting this negative response from me or maybe feeling that they did something wrong, or no, I'm always reassuring them that, hey, thank you so much. I appreciate you bringing this to me. Let's work through this. Let's talk about it. That's got to be something that you incorporate. And then I think lastly, just continuing to praise or give the feedback that they deserve. And it might actually be at a time that maybe they weren't expecting. You don't always have to do it at the review time, the bi-monthly review or the yearly review or whenever you do it. It could just be at a point in time, middle of the day, in the heat of the day when you've got a bunch of patients, where you stop them and just say, hey, I just want you to know this. Like, I just saw how you were with that. I am so appreciative. Thank you. That was awesome. Thank you so much. Boy, does that change the culture. And so I would say those few things will start to change an environment pretty quickly.
Oh, I love that.
Yeah.
I guess from my experience, I got a chance to assess over, probably 80 different clinics, close to 90, and that's chiropractic, that's natural medicine, that's MDs, that's everything. There's a few things that I start paying attention to, and any provider for that matter, I'd suggest to go out and shadow or connect with as many different clinics as you possibly can, multiple scopes ideally.
Yeah.
So there's a few things that you want to look for. Laughter, I love that. Joy, it's such an important thing because it's contagious. It bleeds to the patients, and the whole energy which has a healing effect in itself. So in terms of hearing it, I would look to the sound. What is the type of music? What is the type of energy, vibe, if we will, that you yourself want to elicit with your patients? I started dabbling with these sound frequencies as well, which there's going to be definitely a little bit more of having low-level vibrational frequencies at different hertz, which have different effects, play in the background too. So I'm dabbling with that a little
Yeah.
bit. But when you look at the sound, laughter, the music, that's one thing. The other is going to be light and appearance of when you first walk in. Is it homey? Is it comfortable? Is it their cleanliness? Do they care about their workplace? Do they care
Totally.
about where people spend a lot of time at?
Totally.
So important, not only when they first walk in, the entrance, but even outside the building. Is there garbage around the area? If so, as a clinic director, as a owner, as even a physician, cleaning your environment helps so much more than you may think and realize. So pay
People
attention
pick
to
up
that.
on that. People pick up on that.
So much.
Yep.
Because do they feel comfortable even walking in or going to that area for care
Yep.
itself?
Are you a provider that has to place their hands on a patient to
Yes.
assess them? Trust me, they're thinking, if you don't clean your space, what is? Trust me, they think of these things.
100%. And then I would say the last one would be interaction and knowledge of the physicians or whoever is providing care, whether it's physicians or not, assistants, either or. The communication between patient and worker, pick and choose. Certain conversations might be not the best, and there could be flare-ups, so have a general understanding that there could be certain times that there might be stuff that you may not like when you're first observing, but look at not only one, but maybe a couple interactions. Are there certain things that certain staff members say to the patients? Is it respectable? Are they using swear words? All that matters. And just even the appearance of the staff members too, more from the providers has an influential broadcast to the patients of letting them know that you are the one in charge. You have the backing of what you're saying, more so from a psychological standpoint. But those are a few things that I pay attention to, but I'd suggest, like I said, go out and shadow as many practices as possible, especially as a younger physician or someone that's not necessarily at school, so you have a general understanding of what your practice wants to look like from there.
Yeah.
And then take the best from there.
Yeah, I think observance, people do observe that. They pick on that. Even if it's subconscious, they really do. And I know that when I think about what I would want in a clinic of my own, appearance is going to be right away. That's something that I talk about, for sure. Completely agree.
100%, especially influential. Some of this, if you don't have the environment you think you should have, that'll come down to whether you have control or not, how you can help your staff members, your team, slowly, bit by bit, working to a better environment. So whether it's having a one-on-one training interaction with this individual that constantly has a poor interaction with many different people or patients, that's a good place to start. Having those uncomfortable conversations, and also probably saying the reason why you're having this. If they're not on board with the greater good to help more people, then you might have to look at or try that. Help influence that person or find a different person that can help for your team as well. I think a lot of this will come down to how well you can treat a patient as a team, not just you as a provider, and then not only for that interaction, but how can you replicate that for as many patients as possible, but that goes back to the systems and training from there.
Absolutely.
So,
Yes, absolutely.
yeah. So I think outside the workplace environment, there's also one other financial health implication. Now, we're not any financial experts from here, so I take that with a grain of salt, but when you look at the longevity of your career, you want to find someone that you trust that can manage maybe your funds. So if certain situations, God forbid, injuries come up or anything external that can influence your business, that you have a supporting foundation to where you can come back and rely
100%.
on. So find someone, a financial advisor that you trust.
That's literally what I was going to say.
Yeah.
There could be hundreds of things that we talk about there just because we both enjoy that topic, but we'll leave that to the experts. But by and large, I was grateful enough to meet a financial advisor sooner than later, and the advice that was given to me was so crucial, and I would just only recommend that for those who, as a physician, I'm sure you're going to go from making very little to a lot over your career. And so just to make sure you have that managed appropriately is only going to benefit you. And there might be a point in time where you might get to retire early because you are going to make a good amount of money. And if you want to do this until you die, great. But there might come a time where you're feeling it and you're like, you know what, I maybe should step back or maybe call it a day here in the next year or two. So at least giving yourself that opportunity before you maybe find out that you should have been doing something 20 years ago and now you're behind. So yeah, that's going to be crucial too.
I love that. We'll leave that at bay. I'm sure there's going to be other financial questions. We'll probably look to bring in potentially someone that has more knowledge on that side for you guys moving forward from there. But it's just something that I felt was important, that we felt was important for this topic that we just want to touch on briefly.
Absolutely.
So if you guys have found any awesome, helpful insights, if you know of any of your other doctors that you feel like could benefit from some of this information, please share, subscribe. We're here to help out the masses, but this is something that we thought was important, that the doctors and physicians and healthcare providers usually take the back seat on their own health.
They do.
We want to make sure that they take ownership for the longevity.
And I know you know that because sometimes we're the toughest patients.
Always.
So until next time, guys, thank you so much. We appreciate each and every one of you, Doc.
Absolutely.
We'll see you guys later.
Disclaimer, the content provided in this health podcast is for informational purposes only and is not intended as a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified health provider with any questions you may have regarding a medical condition. Never disregard professional medical advice or delay in seeking it because of something you have heard on this podcast. If you think you may have a medical emergency, call your doctor or 911 immediately. Reliance on any information provided in this podcast is solely at your own risk. The creators and hosts of this podcast are not responsible for any actions or decisions you may take based on the information presented.
Thanks for joining us on The Functional Code. For more evidence-based health insights, subscribe, rate and review wherever you get your podcasts. Remember, your journey to a healthier you begins with understanding the Functional Code. Until next time, stay well, stay informed, and embrace the science of living well.